All right. Dr. Stepovich, an orthodontist. Dr. Stepovich, tell me, are Invisaligns really invisible? I mean, give me a break.
Well, they are clear polycarbonate plastic, which is a very rigid plastic. It's used for store windows in most department stores because it doesn't break like glass. And so that's the same plastic we use, called polycarbonate. And it fits over the teeth and gives the teeth a little extra shine. But I have to admit that most people don't know someone's wearing Invisalign aligners. The aligner Invisalign is used for about 2 weeks, and then the teeth move in that 2 weeks, and then they progress to the next aligner and keep, just moving the teeth a little bit with each aligner, and you get the treatment done. However,
those aligners, which you change every 2 weeks, and every time they go a little further, they're pre-programmed at the beginning of the treatment, like you or the computer programs them, and then they're all already pre-programmed on how they work, or the patient has to come in every single time and do a new mold, a new impression to make them, or what's the deal there?
Well, there are the Invisalign process, which is patented, and they do make all the aligners from the very beginning. You send the case in, and the people at Invisalign put the case on a computer, and you, as the orthodontist, can see what the lab person and the orthodontist in charge of the lab has said what should be done with this treatment. So you can check over on the computer, and you can turn the models of the teeth in all directions and see what is happening. And if you don't agree with that, you can change it. So you can make it, and they send you all the aligners. Sometimes you have 27 changes. Okay? Now, that means that the patient has got to have, at 27 changes, that's 54, that's over a year, that would be, if they wore 2 weeks. I find that I can't get the teeth to all move in 2 weeks so that they can accept the next aligner. So in my practice, they go 3 weeks.
Okay.
We hope that we can get the complete movement of that aligner so that when you go into the second aligner and the third aligner, that you are not
falling behind every time.
Something that wasn't done. Patients have to be very, very good to do this, because the treatment is in their hands, not in the orthodontist's hands. And so I have to guide them to do that. And if I notice that when we deliver a new aligner that it's not fitting right, we have to go backwards and go back to the past aligners and get the teeth straightened, because then the treatment doesn't work. And then you have to go into mid-course corrections. And like you said, take impressions again and start over again from that point on. And indeed, there are other companies besides Invisalign today.
I'm sure there are.
There's Clear Correct, which is probably the closest to Invisalign. And they do not send out all of the aligners at one time. They say that we're going to have a mid-course correction. We're actually going to program that into the program. And so they do a few aligners, and you move the teeth, and then you send in impressions, and you get a new. So what that company is in its infancy, But that whole program that was started by Invisalign is here to stay.
I got it. Yeah. Well, you said something about the treatment is in the hand of the patient, basically, since he can take it out. So I think that's why originally, I'm not so sure, Invisalign was like much more used or even meant maybe for adults, because they're more disciplined in keeping it in all time long, where teenagers, kids, they may just take it out, forget about it, step on it, don't say anything to mom and dad, nobody notices it, and 4 weeks later they didn't wear it, and they may put the next one on it, but they didn't wear the first one, so they, as you said, the teeth haven't adjusted, and well, that's not a good thing. So
totally the case. The orthodontist is in control when you have the braces glued to the teeth and you're bending the wires. You're all in control there. In Invisalign, you're not. And so you have so many compromised treatments in Invisalign. Now, I have a patient that's going to be coming in to see me next week that has had Invisalign treatment and it failed. And they want now to do regular braces, but they don't want to do it with that same orthodontist.
Right. But let me ask you something. It probably, and tell me yes or no, I mean, this is what this is here for, to inform the patients out there. It probably failed not because Invisalign is bad, but because Invisalign gives you the chance of not doing it. Just kind of like, my exercise machine at home. It doesn't work. I guarantee you it's a bad product. It doesn't work because it doesn't take me by the hands, puts me on it, and makes me walking. It just stands there.
Yeah, that is the dilemma with the aligners. The patient, and there's a novelty effect. In the beginning, the patient is all there for you, and they do it, and they keep their appointments, and they wear their aligners, and they put them back after they eat, and they do wear them 22 hours a day. After a while, that is staying, and they're only wearing them 18 hours a day, or they forget them or lose them and don't,
I got it.
So there's so many things that occur there, but with braces on, you can do the nice treatment and you don't have to worry about that.
Right. Let's get back to, let me interrupt you. Let's get back to, like you said, they're supposed to wear 22 hours a day. That 22 hours a day comes from why? Because they need to take it off for dinner, lunch, and anytime they eat?
I think some patients have found you can drink anything, you can drink smoothies and you can drink all your meals and you could pasteurize it. You can put it in a blender and eat everything with it. But people don't do that.
Of course not.
Some people say they can eat pasta with them in.
Okay.
But there are two pieces of plastic that are in between your teeth. And so your teeth don't come together and you really can't grip food and bite into chicken or pizza. So you have to take them out.
Okay.
And
but it's not a bad thing. It's calculated in it, right? I mean, the 2 or 3 weeks of wearing one set of retainer calculates that in it. And it looks to me it has some advantages. You get no spinach caught in the wires. You can brush your teeth afterwards, which must be good for the gums and for gum disease. Not that you can't do it with braces, but that is a problem with real braces, to brush your teeth very good, because you need to have those little things go in between and fiddle it in. I mean, I have a problem flossing my teeth without any wire, never mind if I would have wire, So there gotta be some advantages on that area that you can take it out with food and put it back in. It's just if you then, start taking it out all the time, then you start having a delayed or failed treatment, I guess.
Yeah, the hygiene, the home care, and the condition of the gum tissues is certainly better with Invisalign. You don't get any white spots on the teeth, and even in teenagers' treatments, I don't think we'd ever see that. And so you can take care of your mouth easily with Invisalign, and with braces on, you do have a bigger chore of keeping things clean. So that part is a given, that the aligners are much more healthy to the mouth than to the teeth.
So, maybe then it has still some advantage. They keep saying, I don't know whether it's true, but I let believe it's true, since I was a guy who did join the army. I mean, I didn't join in Austria. We had to join. We got drafted. And over there, they keep saying a guy who didn't get drafted or who dodged the draft, and we had a peaceful army, so we didn't have to shoot at people. We just had to do lots of push-ups, who gets drafted, he comes out kind of more man, not because he's stronger and whatever, but because he's a little more disciplined. You've got to get up at 6, you've got to say yes sir and yes I hear you. You're more disciplined. So maybe if a teenager learns how to wear his braces, he becomes more disciplined. And when he gets 40, 50, he doesn't have the discipline problem I have with exercising, because he knows he needs to do something religiously. Well, what do you think about that, George?
Well, orthodontic patients with braces on in my office, where we have zero bleeding policy, we don't want anything bleeding there. We have a tremendous home care regimen on how to take care of things and keep everything totally healthy. After orthodontic treatment, these patients, they don't have deep scaling and root planing. I'm going to talk about that in gum disease.
I'm going to talk about that in a total different thing, because we're running way our welcome in this time frame. We have allowed it for this particular time. So anyway, I think we got the idea on Invisalign. They are basically invisible. If you have that all-important date or that all-important job interview, and you do feel a little bit uncomfortable having this Invisalign in it, you could take them off, as long as you don't exaggerate, because then your treatment will be delayed and not done. And you do have the advantage of brushing your teeth a little easier. And do you have to go less to the dentist, to the orthodontist with the Invisalign, more or the same than if you would be wearing normal braces?
I think with normal braces, you should see your dentist for cleaning more often.
No, not for cleaning, for the ortho work, the ortho adjustment.
Okay, that in the patients that I've treated with Invisalign, my appointments are three weeks apart, and we get finished, and now we're finished with the last aligner, and we say, okay, that's as much as we can do with Invisalign.
So during the normal treatment, does the patient has to see you slightly more with Invisalign or slightly more with normal braces, with wire braces, or is it pretty much the same?
I think you need to see the patient more with metal braces.
Okay. All right. Well, thanks for letting me know. Thanks for letting our people know. See you later for a different topic. Bye, Dr. Stepovich.
Enjoyed it.